go ahead and get started.
Wait, what's happening right now? Sorry.
Turn this off.
Anyone who isn't a host, please mute yourself.
Over here.
Okay, so today we'll be going over neurology. So you guys, can you type into the chat what you think neurology is?
Neurology.
Something with brain.
Study of the. Wait. Is it the brain? Oh, yeah, you're right. Study of the brain. Everyone said that.
The study of the big brain.
I thought
Someone,
Did already?
the person, Derek, please mute yourself. There's background things going on.
Okay, yeah, so a lot of you got it. It's the study of the brain. So first we're going to start discussing sleeps and dreams. So basically, we all know that we sleep during the night for about 7 to 9 hours because our bodies need to rest. And while we sleep, some of us have images, ideas, emotions, or sensations that occur involuntarily in our mind during certain stages of sleep, which we know as dreams. But have you ever wondered why we get these dreams and what determines what we dream about? Well, you'll get to learn about it now. Even though scientific purposes of dreams are not entirely understood, I'll be explaining the basic reasoning behind dreams. But first, we must understand the basics behind brain function. The brain has nerve cells called neurons, which transmit electrical signals all over the brain, instructing the body on what to do. So when we sleep, neuronal ensembles are groups of neurons with coordinated activity in the sensory cortex, and they activate spontaneously and produce dream imagery from the signal sent up from the brainstem during rapid eye movement, or REM. This is the deepest stage of sleep. There are 4 theories on why we dream about certain things, discovered by scientists. First off, all dreams act as our own therapists and force us to confront our own emotions. When you break an emotional issue in a dream, your brain makes connections that may help you look at a situation on a different light or understand the root of that feeling. Secondly, dreams activate your fight or flight response, replicating what would happen if your life was threatened and helping you figure out what you would do in that situation. The third theory explains how dreams allow us to think in creative ways and help us think of brand new ideas. Lastly, dreams help us remember the information we learn throughout the day and forget the irrelevant ones. Also, this is the reason why your brain is most active during sleep. The brain is making new neural pathways and neurons are sending and receiving signals from one another. Therefore, dreams are beneficial for us and help us in ways we could never have imagined. So here you can see an image of the brain activity during sleep and when they are awake. The different colors shown represent the amount of brain activity going on during these periods of time. So blue is when there is the least amount of brain activity, and red is when there is the most amount of brain activity going on. And this just proves how there is way more brain activity happening during sleep and how sleeping is very important in order for the body to rest and for the brain to organize your thoughts as well as help you through certain situations while dreaming.
So to really understand the
brain
science,
development.
behind neurology, we must understand how our brain develops. So there's 4 main stages, which is also the development of our nervous system. There's child's brain, the teenage brain, adult brain, and brain at an old age. So the child's brain develops during the first 8 years of life and depends on healthy nutrition, which starts in pregnancy. It's exposure to infections or toxins and experience with the outside world and people. This is the stage of life where it's important to influence healthy brain growth and prevent any trauma or stress. Can anybody guess or type into the chat what would be a good way to encourage healthy brain growth for a child? Yeah, so reading is a really good example because it helps set them up for success in school. And this diagram shows how a child's brain changes and develops from 25 days to 9 months. The next stage is the teenage brain, and it makes more irrational and impulsive decisions. Actions are more guided by emotion and less guided by the logical frontal cortex of their brain. It's important to understand that at this stage, the brain is still not fully developed. Can anybody guess what might delay teenage brain development? So in other words, what would make their brain develop slower? Screens. Yeah, so the main one is alcohol and drugs. The third stage is adult brain development, and your prefrontal cortex that handles cognitive skills like solving problems and making decisions is more developed. The brain fully develops around age 25 and intelligence increases. The brain at an old age shrinks and memory loss becomes more common. You have a higher chance of strokes and your brain goes through a cognitive decline. You are also more vulnerable to getting diseases like Alzheimer's and dementia, which we will soon go over as well. So it's important to encourage healthy brain growth as early as possible. Some things we can do include exercising and playing sports, playing a musical instrument which helps with memory, and eating a healthy diet to give your brain all of the nutrients it needs. Some other things include managing stress levels, being socially active, participating in intellectually stimulating activities, and sleeping well. So fun facts, 75% of the brain is made up of water, and dehydration can cause negative effects on brain functions, so it's important to stay hydrated. Another interesting fact is that the brain grows up to 3 times in size its first year of life. Finally, the reason we say girls are often more mature than boys is because a girl's brain can develop up to 10 years earlier than a boy's. This is a good diagram because it breaks down our brain and specifies which functions specific parts of our brain are responsible for. For example, I talked a lot about the development of the frontal lobe, which is the area in red, and it's important for things like speech, sense of smell, concentration, planning, and problem solving. Now let's get into memories and specific brain diseases like Alzheimer's.
Now, in order to understand about Alzheimer's, we first must cover memories. Memories are the events and experiences that we live through, and which are saved and stored in the mind. As you grow older, memories build up over time and essentially are the building blocks of what makes you, you. There are 3 major types of memories, which include short-term memories, long-term memories, and sensory memories, each specifically designed for certain situations. Sensory memories are the basis to our neurological system. By using the 5 senses, it takes in information based on what occurs around you. The 2 most common types of sensory memories are iconic memory, which is used in sight, and echoic memory, which is used for what you hear. But since there is so much going on around the world, our minds cannot focus on them all at once. Instead, it focuses on a few specific things. This uses our short-term memory, or working memory, which is essentially the current thoughts in your mind. There is no quantitative description or number to show how much our minds can hold. And the working memory processes all this information in our minds decide to take in, and this is where the long-term memory comes in. There are relatively 2 types of long-term memories, which are explicit and implicit. Explicit memories are memories that occur while conscious, or when you're awake and focused. These include memorizing definitions to words, spelling, and past events, which are known as semantic for words and episodic for events. Implicit memories, on the other hand, is a bit more complicated. When you walk, do you really concentrate on how far you step, which leg to swing, and when to push off? This is an example of implicit memory, where the things you previously learned or learned before are automatically remembered into the nervous system. This type of long-term memory is procedural memories, as named for the procedures learned to walk. The last type of long-term memory is called priming, which is your interpretation of an event based on previous events. For example, what word would you think if I said 8? Is it the number 8, or is it the past tense of eat, like I ate food? Let's say you're doing math that morning. You would have thought of the number 8 because it appeared previously before. Now, dementia in summary means the loss of memory, and Alzheimer's is one of the leading causes to dementia. Being a terminal disease or incurable, it takes fundamental care and support from others, especially love from family and a tolerable or easy to withstand surrounding environment. Alzheimer's is also most commonly known to be the disease for forgetting. This is because the neurons in the brain die, causing the cerebral cortex or the size of the brain to shrink in size. A few symptoms that occur with AD or Alzheimer's disease are significant memory loss as the disease progresses and language difficulties. This could include forgetting who people are, how to walk, and much more. Because of this loss in memory, people with it may also have a sudden change in behavior. 1 minute they may seem calm and relaxed, but in a split second they can turn angry or fearful. These changes could also be gradual. The last thing that I will cover are the different stages of Alzheimer's. There are 3 main stages, which are early stage, middle stage, and late stage. Early stage Alzheimer's isn't the worst, as people who have it just tend to forget things. This is also commonly mistaken for forgetfulness due to the person's age. As we get older, we tend to forget things easily. Early stage AD people need some support, and especially needed when driving, attending appointments, and when handling financial decisions. Now with middle age Alzheimer's, it has a greater effect. These people can carry on with their lives, but most cannot do it alone. They may need to be reminded to do certain things, and forgetting is more common. A heavy effect it leaves is not being able to differentiate the past and the present. This means that they may be thinking about events that have already happened, and the most common is thinking that their parents are still alive. The last stage is late stage Alzheimer's. People with it constantly require support from others and may begin to lose control of their bodily functions. This could affect their walking abilities, need help with eating and drinking, and breathing could even be a problem. On average, people in late-stage AD only live up to another 6 years upon diagnosis, or when the condition is identified. It is a very harsh condition once it reaches the late stage. If you want to learn more about memories or Alzheimer's disease, please visit the National Center for Biotechnology Information's website, or NCBI for short. They provide a more detailed explanation about Alzheimer's and memories.
Oh, Parkinson's disease. Let's learn about it. Okay, so what is it? What are possible causations? What can we use to fight against it? At what ages are they most common? How is this related to neurology? And why is this relevant? So yeah, Parkinson's disease is a long-term neurodegenerative disorder that affects dopamine-producing neurons in the brain, which affects the motor system. But in simple terms, it affects your movement. Causes or things that can raise your chances of having it are genes, environmental triggers, Lewy bodies, which are abnormal groupings of protein that develop inside the nerve cells, which in part are made of protein called alpha-synuclein, which mutations of it influence the development of Lewy bodies inside the neurons. And the development of Lewy bodies in neurons lead to neurons to lose contact with its neighbors and gradually disappear. This loss of neurons in the brain leads to a significant drop of dopamine, which in the diagram show to how dopamine affects our movement and how Parkinson's is a disease that negatively impacts the production of dopamine, give rise to movement disorders. Okay, risk factors include age. It's a long-term degenerative disorder, so it grows over time. Heredity. Having relatives with the disease that increases the chance of you getting the disease. That men are more likely to develop the disease. Exposure to toxins, such as herbicides and pesticides, may increase your risk of Parkinson's. And when it comes to prevention, there are so many unknowns of this disease, but scientists have found possible correlations between Parkinson's and aerobic exercise, caffeine, and green tea. Why is this relevant and why should we care? Well, it's relevant because it's a disease of the nervous system, and that's what we're learning about today. And why should we care is because further research could allow us to further understand this disease, further understand the proteins in our body, and how we can prevent it from hurting ourselves.
So now we're going to be talking about the Huntington's disease. First off, the Huntington's disease is extremely rare, so I doubt any of y'all have heard of it. Basically, it's a hereditary disease, meaning it passed on from person to person via a gene. So if my mom had that gene and it got passed on to me, I could potentially have the disease. But having the disease doesn't necessarily mean I will suffer from it, as I could be asymptomatic. Think of it like the coronavirus. Some people are suffering from it, but others are experiencing no symptoms. It is the same thing here. Having the Huntington's disease is almost like having Alzheimer's, Parkinson's, and ALS at the same time. So what does this deadly disease do? In simplest of terms, the disease deteriorates nerve cells inside one's brain. This causes people to lose control of their movement and their speech. They're also usually suffering from depression and mood swings. Sadly, there is no cure, but there are drugs that can slow down the deteriorating of the cells. It's kind of like the disease is a group of ants, and the nerve cells are breadcrumbs. The ants go on devouring crumb by crumb. There is no way to kill all of the ants, but you can kill one or two. Now, what causes this disease to pretty much eat the brain cells? Well, basically our DNA contains protein, and within that protein there's a sequence called the polyglutamine sequence. Some people's polyglutamine sequence is too long, resulting in the Huntington's disease.
Seizures, the thing everyone hears and thinks about someone in a movie jerking around when they look possessed, but it's a little different than that. Does anyone know how many types of seizures there are? Write in the chat how many types of seizures you think there are. There are two categories for seizures. Generalized seizures, which affect both sides of the brain, which include absence seizures and tonic-clonic seizures. There are also focal seizures, which are only in one area of the brain. These are sometimes called partial seizures and include simple focal seizures, complex focal seizures, and secondary generalized seizures. But what really is a seizure? A seizure is a sudden and uncontrollable electrical disturbance in the brain. Though a lot of causes for seizures are unknown, some known causes are a closed head injury, stroke, or an infection such as meningitis. Meningitis is an infection of the membranes protecting your brain and spine. Some symptoms of a seizure are temporary confusion, uncontrollable jerking motions in the arms and legs, a staring spell, loss of consciousness or awareness, or cognitive symptoms such as fear, anxiety, or déjà vu. Not all seizures are emergencies, especially if someone has been diagnosed with a seizure disorder such as epilepsy. But if it's someone's first seizure or the seizure lasts more than 5 minutes, it's best to call 911.
A stroke happens when blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from getting enough oxygen and nutrients. Brain cells begin to die in minutes due to this lack of oxygen and glucose. Prompt treatment can reduce brain damage and other complications. There are two main types of strokes. About 80% of strokes are ischemic strokes, which occur when clots form in blood vessels in the brain, near the brain, or in another part of the brain, or another part of the body, which then travel to the brain. Hemorrhagic strokes are less common, but common nonetheless. This occurs when a blood vessel in the brain breaks or ruptures and the blood seeps into the brain tissue, damaging brain cells. The first symptom includes trouble speaking and understanding what others are saying. The person may experience confusion, slur their words, or have difficulty understanding speech. The second symptom is sudden paralysis or numbness in the face, arm, or leg. This often affects just one side of the body. The third symptom involves problems seeing in one or both eyes. The person may suddenly have blurred or blackened vision in one or both eyes, or they may see double. The last two are pretty self-explanatory. A sudden severe headache, which may be accompanied by vomiting, dizziness, or altered consciousness, may indicate a stroke. Stumbling or losing balance, along with sudden dizziness or a loss of coordination, is the last sign of a stroke. To detect a stroke, remember to think fast. The F stands for face. Ask the person to smile and check if one side of their face droops. The A stands for arms. Ask the person to raise both arms and see if one arm drips downwards or is unable to rise. The S stands for speech. Ask the person to repeat a phrase and listen carefully for slurred or strange speech patterns. The T stands for time. Every second counts with a stroke. The sooner it is treated, the better. Call 911 immediately. You can reduce your risk of a stroke by living a healthy lifestyle. This includes eating healthy foods and exercising regularly.
The next thing we're going to talk about is multiple sclerosis, aka MS. So MS is a disease in which disrupts the communication between the brain and the body, resulting in nerve damage. MS can cause many different symptoms throughout the body. This is a very rare disease that has fewer than 200,000 US cases per year. There can be treatment, but there's no cure for MS. Symptoms: tremor. It mostly occurs during precise movements in the hands or different limbs. Muscular. Cramps and difficulty walking or having a rapid spike in movements. Visual. Blurred vision, doubled vision, like when you cross your eyes. Speech. Difficulty speaking or slurred speaking. There are many more symptoms depending on the person. Some of the treatments are medications, including chemotherapy and anti-inflammatory. Some therapies are physical therapies, support groups, and even acupuncture.
Transverse myelitis is a neurological disease that is caused by swelling or infection on both sides of a section of a person's spinal cord. This causes the spine to be incapable of sending electrical signals from the brain to the rest of the body. Other causes of transverse myelitis can be viral, bacterial, and fungal infections, body tissue attacks resulting from immune system disorders, or even other neurological diseases such as multiple sclerosis. Symptoms can be weakness in the muscles, shooting pains up a person's arms and legs, problems with senses, or the bladder not functioning properly. The symptoms are caused by the spine's inability to send the electrical signals from the brain to the rest of a body. Treatment consists of therapy and medications, and afterwards, patients may have no disabilities, moderate disabilities, or even severe disabilities.
Our next topic is neurosurgery. Neurosurgeries are performed by neurosurgeons. It is surgery involving the nervous system, which includes the brain, spinal cord, central and peripheral nervous system, and the cerebrovascular system. There are numerous procedures and surgeries performed by neurosurgeons. We will be going over two of them: craniotomies and aneurysm repairs. A craniotomy is the surgical removal of part of the skull. It is done to expose the brain for surgeries. The bone flap is temporarily removed and replaced after brain surgery. This shouldn't be confused with craniectomy, which is when the bone flap is either permanently removed or is replaced with a second surgery after the swelling in the brain goes down. A ruptured aneurysm in the brain can be treated in two ways: surgical clipping or endovascular coiling. Surgical clipping is a procedure in which a craniotomy is performed to access the aneurysm, and a tiny metal clip is placed at the neck of the aneurysm to stop the blood flow to it. Endovascular coiling is a procedure in which a catheter, which is a small hollow tube, is inserted into an artery, usually through the groin. The catheter is threaded through the body to the aneurysm. Then a soft platinum wire is pushed through the catheter and into the aneurysm. The wire coils up inside the aneurysm and disrupts the blood flow, which hopefully seals off the aneurysm. Both methods have risks, particularly loss of blood and bleeding in the brain. The endovascular coiling is less invasive, so it seems safer in the beginning, but it actually has a slightly higher risk for the need of a repeat procedure in the future. But there are risks with every surgery, and sometimes the risks need to be taken in order to save the patient.
The next topic is schizophrenia. What do you think it is? What have you heard about it? Feel free to respond in the chat, or if you feel comfortable, raise your hand in the reactions or participants bar and wait to be called on to answer. Okay. So let's see how close you were. Can you move the, yeah. What is schizophrenia? Schizophrenia is a mental illness that impacts the way someone thinks, feels, and behaves. You may have been exposed to movies that feature schizophrenia, such as Joker, The Dark Knight, Black Swan, and A Beautiful Mind. There are many more, and you may see schizophrenia portrayed in movies you see later on. There are many symptoms of schizophrenia. Delusions are when someone believes in something outside of reality, like thinking they are famous when in reality they are not. Hallucinations occur when you hear, see, or experience something that didn't happen. Hallucinations could involve any of the senses, but the most common is hearing voices. Disorganized thinking impacts one's ability to think and speak properly. In rare cases, speech can be impacted to result in the person putting together meaningless words to form incomprehensible sentences. Negative symptoms refer to a reduced or lack of ability to function normally, such as neglecting personal hygiene or seeming to lack emotion. Schizophrenia is typically diagnosed in late teens to early 30s and emerges earlier in those of the male gender. After hearing about schizophrenia, you may be wondering if there are any treatments. Well, there are. The treatments are used throughout the person's life, even if the symptoms have subsided. Treatments include antipsychotic medication and psychosocial interaction or therapy. There are many types of antipsychotic medications. There are first-generation medications like fluphenazine and haloperidol. Haloperidol. Second-generation medications are safer and thus preferred, and they include medications like clozapine and risperidone. There is also psychosocial interventions and/or therapy. Therapy is a type of psychosocial intervention and includes individual therapy like group therapy and family therapy. Rehabilitation is another form of the intervention in which one is taken care of and is used to encourage those with diseases or mental illnesses like schizophrenia to get back to their regular lives, and also helps them get jobs.
So next we'll be talking about brain cancer, and this disease usually affects older people. So some of the symptoms are dizziness, headaches, seizures, personality or memory changes, nausea or vomiting, fatigue, drowsiness, sleep problems, and memory problems. So there are two types of abnormal brain growth. There's benign, which is non-cancerous, and malignant, which is cancerous. Although benign growth is not cancerous, it can cause a lot of harm as it grows and affects the brain's function. Brain cancers are caused by the growth of malignant brain tumors. There are two main classifications of brain cancers, primary and secondary. Primary brain tumors start in the brain and tend to stay there. Secondary brain tumors are more common. These cancers start somewhere else in your body and travel to the brain. Lung, breast, kidney, colon, and skin cancers are some of the most common cancers that spread to your brain. Then there are more specific types of brain cancers based on where the growth begins. Astrocytomas form in the largest part of the brain, the cerebrum. Glioblastoma occurs in the brain or spinal cord and is very severe because it spreads very fast. Meningiomas are the most common primary brain tumors in adults. Oligodendrogliomas in the cells that make the covering protects the nerves that grow slowly and do not spread. For diagnosis, you can have a physical exam, scans such as CT and MRI, and also a brain tissue biopsy. Some treatments include surgery and radiation, as well as chemotherapy. This is an image of a scan. Brain tumors are very hard to see, as you can see in the image, and you need to be really trained and professional in order to see them and identify them correctly. So just a recap of what we went over today. We talked about these topics, and we also have an Instagram that we started recently to help keep you guys updated about our program. So you guys can go ahead and follow that to stay caught up with all of our presentations and the opportunities that we offer. So as I've mentioned, we have a guest speaker coming at our next meeting on November 15th from 10 a.m. to 10:40 a.m. Dr. Manal Akara is a family doctor at Kaiser Permanente. She grew up in San Francisco and attended Lowell High School. And so you can submit your questions to her through this form. And we also have a fall programming sessions outline. Does anyone have any questions about what we went over today? You can feel free to send them in the chat.
I have a question though.
Okay,
How do you get schizophrenia?
what is schizophrenia? Sydney, do you want to explain that?
Yeah, I just responded in the chat.
Okay.
So the cause of schizophrenia isn't known, but researchers believe that a combination of genetics, brain chemistry, and environment contribute to the development of the disorder.
Oh, it's a birth defect.
You wouldn't normally call it a defect, but in a way, I suppose, like, even though it's not completely known, it is believed that genetics do have a contributing role in the development of schizophrenia.
Yeah, definitely. So kind of in medicine, there's a lot of diseases and we're not sure about the causes of them, right? So we rely on researchers. So, you know, if you guys are interested in medicine and going into research, you could be the ones to identify the causes for these diseases and how to prevent them. Are there other questions? I can look in the chat. Are there certain causes for Alzheimer's, or does it just come for no reason? Justin, do you want to answer that?
There is no known cause for Alzheimer's. It kind of just I don't know how it. Yeah, but like according to NCBI, there's no like known direct cause for Alzheimer's. It's also you can't inherit it from like past ancestors or your parents or whatever if they have it. So you don't. So it's not genetically inherited, but yeah, I'm gonna repeat myself a lot. There's no known cause for Alzheimer's.
Yeah, the diseases in the brain are pretty interesting. We haven't really discovered a lot about them yet, so it's definitely a field that is worth going into and researching. For those of you who joined a little late, these are the topics that we talked about, and I can definitely send out the recording of this session, and also we can send out the slides if you would like. So if there are no other questions, thank you so much for coming today. And we'll see you in 2 weeks for the speaker session with Dr. Akara. So thank you for coming.
Well, I thank you